Thanks again, everybody, for being here today with us. My name is Mariana Santoyo. I work with UNFPA's Sub-Regional Office for the Caribbean as a regional GBV specialist since 2020. And I will allow Megan to also introduce herself.
Good morning, everyone. My name is Megan Denise Smith, and I'm a gender-based violence specialist supporting UNFPA's Sub-Regional Office for the Caribbean as a consultant. Pleasure to be here.
Thank you, Megan. So the day is here. We're very, very pleased to be hosting this launch today. It is the result of about 3 years of work, particularly together with the Essential Services Package Community of Practice, the ESP-COP, under the Regional Spotlight Initiative for the Caribbean. It is the result of in-depth research, key informant interviews, focused consultations with key informant specialists, technical specialists around the region, and a number of validation sessions and meetings, everything, of course, supported by 4 wonderful consultants that we have hired throughout the different stages. We are very proud of what we have been able to accomplish in the past around 3 years. And we're hopeful that the analysis, recommendations, and the research package with practical tools is going to be useful for member states to advocate and ensure services of quality are offered to survivors wherever they choose to access them, including during humanitarian emergencies. Let's go to this next slide, please. Thank you, Tommy. Today's session is going to be short and to the point. Essentially, we just want to give you a very brief background to this work, how it came to be, the global framework from which it has been adapted, and we will give you an overview of the main findings from the comprehensive study, which is going to provide the basis of the ESP research package. Next slide, please. Thank you. However, without further ado, we would like to allow for the opening statements for this launch from 2 Caribbean leaders who have made all of this possible, 2 fierce advocates for the empowerment of women and girls, access to comprehensive sexual and reproductive health services and rights for all, and particularly putting an end to gender-based violence in the Caribbean, Ms. Alison Drayton and Ms. Elizabeth Arnold-Talbert. Let's listen to their opening statements, please. Ms. Alison Drayton is the Assistant Secretary General for CARICOM Secretariat. Ms. Drayton, thank you so much for being with us today. The floor is yours.
Mariana, thank you very much, and how lovely to see you and Megan again. I will try and be short, but as you know, I am passionate about this work, which I think has made such a difference in the region over the years since the ESP-COP was established. So this is an important milestone. Since the launch of the Regional Essential Service Package Community of Practice in May 2022 in Trinidad and Tobago. The unveiling of the lessons learned study of the ESP and the accompanying resource package tailored for the Caribbean region. This initiative represents a significant step forward in addressing gender-based violence in times of emergency, utilizing a comprehensive humanitarian development, peace-centered approach. I'm just going to pause and say that to me, the robustness of this exercise and its value was amply demonstrated in the response to the volcano eruption in St. Vincent and the Grenadines, because the team had just concluded the capacity building of all of the practitioners across the region, and the way in which the international community, very much UNFPA in its role, was able to work with those first responders at the national level. Really, the amount of time saved, the ease, the deftness of the response, I think was all the proof that one would need of how important this work has been. It is crucial to recognize the dedication and collaboration of all stakeholders involved in this endeavor. And my thanks to everyone, government agencies, non-governmental organizations, civil society actors, and spotlight partners for taking part in the comprehensive review of the status of implementation of the ESP. Together, we have embarked on a journey to better understand the gaps, capacities, and opportunities in responding effectively to GBV, recognizing that emergencies demand a multi-sectoral, integrated, and gender transformative approach. The lessons learned study we are launching today is not just a document. It is a testament to our collective commitment to enhancing the lives of women and girls, as well as survivors of violence in the Caribbean. It serves as a mirror reflecting our successes, our challenges, and the path ahead. In adopting a humanitarian development peace nexus, we acknowledge the interconnectedness of these three pillars, emphasizing the need for comprehensive, sustainable solutions. The report's main outcomes have been pivotal in shaping the development of an adapted ESP resource package. This package is designed to support the implementation of the ESP across diverse national contexts in the Caribbean region. It aligns with interagency standards and good practices, ensuring a harmonized and effective regional response to GBV. In navigating the complexities of emergencies, our responses must not only be timely, but also comprehensive and sensitive to the unique challenges faced by women, girls, and survivors in the region. The adapted ESP resource package stands as a symbol of hope, providing a roadmap for action that prioritizes the well-being and dignity of those affected by violence in the Caribbean. As we launch this study and its accompanying resource package, let us renew our commitment to collaboration, inclusivity, and innovation. Let us strive to bridge the identified gaps, build upon existing capacities, and seize the opportunities that lie ahead. Together, we can create a safer and more resilient Caribbean, one where the survivors of violence receive the support they need, despite the challenges that come with emergencies, in a region that has had its fair share of emergencies. And it's no secret that we will continue to experience more severe floodings, stronger hurricanes, and hotter temperatures due to the climate crisis. Thank you for your dedication to this critical cause. Let us move forward with determination and compassion, ensuring that the lessons learned today pave the way for a more secure and just future for all. As I end my remarks, I cannot do so without recognizing and appreciating the singular contribution that Mariana Santoyo has made to this process. Mariana designed the process that brought us to today's launch. She has worked with dedication, passion, and commitment, and with a love for what is not always the easiest region to work with. And she has steadfastly held the hand of the Secretariat throughout this process. It has been a privilege to work with you, Mariana. I think today is one of our last meetings with you. I know you're moving on. It is a huge loss to the region, but on behalf of all of us, I wish you the best, and I hope you keep us in your heart. Thank you.
Alison, thank you so much for your wonderful remarks, for your beautiful words. It has been an absolute pleasure to work together with you. And I really appreciate that you are joining us here today to see the culmination of our collaboration, hopefully not the last one. Thank you so much. Now, Ms. Elizabeth Arnold Talbert, who is the Director of the Sub-Regional Office for the Caribbean at UNFPA. Thank you so much for being with us today. The floor is yours.
Thank you very much, Mariana. Good morning to all. Alison, our representatives from the Department of Gender in the region, and those representing civil society, health, education, security, and justice sector. I want to start off by where Alison left off. Yes, Mariana, you have done a wonderful job. She said about you leaving. Listen, there'll be opportunities for you to come back to the region and help us. Trust me. It is a distinct pleasure to bring remarks at the launch of the Essential Services Package Lesson Learned and Resource Package for the English and Dutch-speaking Caribbean countries. This is the culmination of almost 3 years of hard work by the ESP Community of Practice, funded by the European Union through the Regional Spotlight Initiative in the Caribbean. UNFPA is pleased to have collaborated once again with CARICOM Secretariat on this initiative that will support governments and key regional institutions in preventing, responding, and mitigating gender-based violence and harmful practices. GBV is particularly violence against women and girls. It is one of the most widespread, persistent, and devastating human rights violations. It is estimated that globally, 1 in 3 women and girls will experience some form of GBV in their lives. In the Caribbean, for example, domestic and family violence is a complex concept, as violence may take place in formal and informal settings, as well as intimate relationships within different households. The Regional Spotlight Initiative seeks to contribute to addressing and preventing all forms of gender-based violence, with a particular focus on violence against women and girls, as well as ensuring adequate survivor-centered care and access to services for all persons in need of or at risk. It is a multi-year partnership between the EU and the UN, which represents an unprecedented global effort to invest in gender equality and women's empowerment as a precondition and driver to achieve sustainable development goals. As one of the UN agencies contributing to Pillar 2 of the Spotlight Regional Program, UNFPA is supporting the design, launch, and implementation of the Regional Essential Services Package Community of Practice. UNFPA is the lead UN agency on sexual and reproductive health and rights, and leads the global GBV area of responsibility under the Interagency Standing Committee, and as such, will ensure the development and humanitarian linkages throughout this intervention. The Essential Services Package Community of Practice identifies a diverse and interconnected set of key actions required to address violence faced by women and girls. The goal is to ensure that all women and girls, especially the most vulnerable, live a life free of violence, including during humanitarian emergencies, when all forms of GBV dramatically increase and disproportionately affect women and girls. Today, we are proud to present this study reflecting the result of a comprehensive review of the status of implementation of the ESP, where we identified different challenges, best practices, and lessons learned across our region. We did this as a commitment to fulfill a general request by all standing members of the ESP Community of Practice during their launch in Trinidad and Tobago to better understand gaps, opportunities, and capacities to strengthen their work in offering quality services for survivors of GBV. The main findings of this study have informed the development of a resource package that has tailored to the needs identified in the region. The package supports the implementation of the ESP at every stage, in line with interagency global standards, best practices, and ensuring a humanitarian development nexus approach. Ladies and gentlemen, this resource package, which has been contextualized specifically to the English and Dutch-speaking Caribbean, will enhance our regional capacity to ensure coordination and governance around the prevention and response to GBV, as well as identify key ways in which regional institutions and entities can support the implementation of the ESP at national levels. This will be done with clear guidelines and tools that can be adapted according to national priorities and capacities. At this time, I take this opportunity to thank our partners for their unwavering support and contribution to this initiative, particularly the European Union for their financial support, and the CARICOM Secretariat, with whom we are collaborating. We are indeed grateful for your continued commitment to our mission to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. Thanks to the team that worked so hard in putting this together, Mariana, and if I to go through the list, I won't finish now, but all of you who have contributed to us reaching the stage of launching this package. Thank you very much. Bye.
Elizabeth, thank you so much for your words and for your support throughout this whole process and for being here. These opening remarks were very, very special. They were very significant, and I'm really grateful to be able to work with these two amazing women and leaders. This is such a privilege. So thank you so much to both of you for being here, for your words, and for your support. So let's continue with the lunch. I wanted to first give you, and to those of you who are not so familiar with what we talk about when we talk about the ESP, the Essential Services Package, just a very brief introduction for you. Let's go to the next slide, please. Thank you, Tommy. The United Nations Joint Global Program on Essential Services for Women and Girls Subject to Violence, the program, is a partnership by UN Women, UNFPA, WHO, UNDP, and UNODC, and it aims to provide a greater access to a coordinated set of essential and quality multi-sectoral services for all women and girls who have experienced some form of gender-based violence. As such, the ESP, as we call it, was launched in 2015. The program identified as the title says, the essential services that we need to be provided to survivors of GBV by the health, the social services, the police, and the justice sectors, as well as guidelines for the coordination of these services and the governance of different coordination processes that must be in place and different mechanisms that are needed to ensure access to these essential services in comprehensive and meaningful ways. These are service delivery guidelines for the core elements of each essential service, which have been identified to ensure the delivery of high quality services, particularly for low and middle income countries, for women and girls who are experiencing violence. And these taken together are elements that comprise the essential services package, right? So this is the general overview, the global overview of the ESP. Let's go to the next slide, please. So let's dive in a little bit more to where we are in the Caribbean, right? Because yes, we are taking this global tool that has been implemented in many countries, but what are we doing in the Caribbean, right? We are currently implementing the ESP in some countries in the Caribbean, and we're grouping, as I said before, the essential services in the four standard sectors of work: the health, social services, justice, and police. And underpinned, all of these underpinned by the fifth element, which is the essential actions for the coordination and governance of these services, right? However, what makes the Caribbean unique and how we have gone beyond, the standard package, innovated and, created, adapted the tool to the specific region, was by identifying two core additional areas of work that we considered within the ESP community of practice as priority. And this was agreed upon in the launch that we had in Trinidad and Tobago in the in-person meeting. The first one is the education sector. right? So we have been working to develop education sector essential services standards to be included in this package for the Caribbean. These standards are currently being developed with the support and leadership from UNICEF and CARICOM, and they're at the final stages. They're going to be soon endorsed and launched. And basically, the Caribbean is becoming the first region in the world to integrate the education sector into the ESP, which is crucial, right? Because responding to violence against women and girls and violence against children is intersecting. It is also a key entry point early on for child survivors and parents who look to support their children and to mitigate GBV risks, right? The second component where we have innovated is the humanitarian component. As both Alison and Betty were talking about in their opening remarks, the Caribbean is very prone to emergencies, right? So we are taking into consideration the specific context in which we work, where humanitarian emergencies are always a threat, right? Specifically natural disasters, but also refugee and migration influxes and anything related to climate change, as we have seen over the years. Hurricanes are getting stronger, right? So basically, given that UNFPA is the lead UN agency chairing the global GBV area of responsibility in humanitarian settings, we are working to ensure at the global level, but also at the Caribbean, that all of these essential services continue to be available and ready to be adapted during humanitarian emergencies, where GBV becomes an even bigger issue, right? Services usually collapse, social networks are broken. Usually the response to GBV becomes a secondary priority, as we have seen as well during the COVID-19, where the main priority was, of course, to support the response to the emergency and the pandemic, but where survivors were also isolated, right, with their perpetrators at home with nowhere to go, and the violence increased. So by applying this nexus approach, we make sure that every single survivor of gender-based violence continues to be able to access life-saving services, even if there is a humanitarian emergency, and that from the start, services are prepared to adapt. Because of course, we don't know what's going to happen in the next emergency and how it's going to affect, but at least ensuring that these services are ready to be adapted, to adapt to the specific context, we can mitigate some risks, right? So this is the aim of this nexus approach. Let's go to the next slide, please. Also, by the way, you can share your questions and any comments that you may have, and we'll get back to those at the end of the presentation. But thank you for sharing and start writing in the chat. So how does the ESP relate to the Spotlight Initiative, right? The Spotlight Initiative, as you know, is the largest investment on a global program to end violence against women. And the ESP will inform the Spotlight Initiative's work on establishing and strengthening services to respond to violence against women and girls. The ESP is implemented in over 50 countries in the world. And in the Caribbean specifically, it is being rolled out in 7 Caribbean countries through the Spotlight Initiative, particularly funded by the Spotlight Initiative. These countries are Belize, Grenada, Guyana, Trinidad and Tobago, and Jamaica. However, we also have St. Lucia and Suriname, who are also in the process of rolling out the ESP, and they have been supported by UNFPA and other donors to implement the package in what we call as self-starter countries, right? Because they wanted to implement it, but they needed to find the funding somewhere else. So under the regional community, the regional Spotlight Initiative, we have created the Essential Services Package Community of Practice, which is an activity that contributes to promoting exchanges, cooperation, learning under the framework of the ESP and the Spotlight Initiative. and adheres to a humanitarian development nexus approach, as I was discussing before, guided by international standards for emergency response, as well as the ESP. So we're basically putting all of these global tools together and applying them to the Caribbean, focusing and adapting to the context. Let's go to the next slide, please. Now, the famous community of practice. It was officially launched in April 2022 in Trinidad and Tobago during the first regional GBV in-person meeting ever held in the region. And since then, we have been meeting regularly. And this year, we have been meeting every 2 months virtually. It is currently co-chaired by CARICOM and UNFPA. And every single country in the region is represented by a focal point of their national gender machineries. In addition, we have, of course, key regional institutions who are representing the 4 ESP pillars of work, such as, for example, SEDIMA, right, who represents the humanitarian sphere. They are also present as standing members, as well as also selected CSOs, and some of them who attend as observers sometimes during some meetings. UN agencies are also part of the community of practice, and we essentially act as technical advisors, right? So standing members of the community of practice signed a compact of commitment in Trinidad and Tobago to solidify their support and the active participation in the community of practice, as well as to contribute and actively participate in meetings and in joint work that we create together. The COP is essentially a coordination mechanism that represents the backbone for technical assistance, support, collaboration, and guidance between national and regional stakeholders in their own areas of work, as well as, of course, ensuring a multi-sectoral coordination approach, service provision for GBV survivors across the region that it's like of a certain standard. Through the community of practice, we aim for greater promotion of exchanges, cooperation, and learning to standardize, endorse, and facilitate the development and the implementation of technical guidances and tools in line with the ESP and other global standards that are contextualized to the region. And the greater aim of this mechanism is to enhance the capacity of all the member states to ensure coordination and governance of all the sectors under the ESP for the prevention and response to GBV with technical coherence and complementarity, as well as ensuring a humanitarian development nexus approach in everything we do. So this was basically an introduction to the mechanism and the people, the institutions that are behind these 2 products that we are launching today, which have been basically our main deliverables in these past years. Let's go to the next slide, please. So basically, what have we accomplished, right? Like, yeah, Mariana, you talk about the community of practice and all these meetings, but like, what have you actually done? And what is it that you're presenting today? So we have the lessons learned study and the ESP research package. These are 2 different resources, right? The lessons learned study is the result of a number of key informant interviews and an extensive desk review that we have conducted in 2 phases between 2022 and 2023 with the support from 2 different consultants in the 2 years. The purpose was to basically conduct an assessment, a very comprehensive assessment of where we are in the implementation of the ESP, right, in all of the countries, because not all the countries are at the same level of work. They don't all have the same resources and tools, right? So we basically mapped the different gaps, the capacities, the good practices in the provision of, in general, services to GBV survivors in stable and humanitarian settings. We identified specific challenges and general challenges and lessons learned around the implementation of the ESP to those countries who had already implemented or were in the process of implementing the ESP. And we compiled a full report and an in-depth analysis of where we are, each country, and as in a regional perspective, right? And compiled a set of recommendations in order to accelerate this implementation of the ESP and support all countries, right? To make sure that no country is left behind, and that through the community of practice, we can support each other to, share resources, lessons learned, and tools, and standardize the implementation process. So based on this, which we also presented during the first, the launch in Trinidad and Tobago, we also identified the main need, which was clear from the beginning. Okay, we have the ESP resource package, but what do we do with this, right? Like, this is a global a document, a program that, it sounds great in theory, but how do we implement this? Like, this is huge. This is overwhelming sometimes, right? So this was the main gap, if I can say. We identified many different gaps and opportunities for the future, but this was the main gap that we identified during the in-person launch, where we did some, workshops and conversations with all member states, which was basically the lack of practical tools and guidance to implement the ESP further than the global ESP package, right? Like this document that we have. So again, we did a number of consultations with key stakeholders to understand the type of guidance that was needed. We did a review of the existing tools and the ones that have been used in the past or were currently being used in countries who were rolling the package out, or who were thinking of doing it, or who were at a different stage. We compiled a comprehensive resource package, right, which is essentially a folder with tools and practical resources that you can use to guide member states clearly and step by step, with instructions, practical tools to guide countries in every stage of implementation, right? From the beginning to the implementation of the assessment that some of the countries have already done, the report, the recommendations, how to apply those, right? The ESP resource package includes training modules that you can also adapt to your context and your needs, but like standardizing, the guiding principles, the different approaches, to make sure that we all work under the same umbrella, right? Templates that you can adapt, ranging from terms of reference for people that you hire or for yourselves as gender focal points, to advocate for, add a bit of formal roles and responsibilities within your current TOR, to be able to dedicate some time to this work, because we know that a lot of you are a little bit overwhelmed with so many things to do. We have also, provided templates to guide you and to support you in resource mobilization efforts, like how do you write a concept note? How do you make sure that this budget makes sense? How do you make a proposal to a donor, right? All of this was requested by you, so we have developed this, and we are offering this to you to adapt and to use as you see fit. And we're also including key technical resources and guidances, including costing tools by sector of work, that you can adapt and use freely during the implementation process of the ESP in your country. So I think I have talked too much, and now I'm going to allow Megan to go a little bit more in depth into these two products. She was the consultant that we hired for this final stage of putting everything together and finalizing it. She has also worked tirelessly in finalizing this and making sure that this is coherent and it can be understood by everybody. So she's going to go through this a little bit more in detail. Megan, over to you. Thank you so much.
Thank you so much for the kind introduction. And Tommy, we can actually switch to the next slide. Thank you so much. So just building from Mariana's introduction, I'll just be providing a brief snapshot of some of the key challenges and best practices from the Lessons Learned study, which informed the overall development of the ESP resource package. And of course, I do encourage you to read the full report, which is available in English and Dutch language, that you'll find at the end of this presentation. Next slide, please. So the ESP is currently being rolled out in 7 countries in the Caribbean: Belize, Grenada, Guyana, St. Lucia, Suriname, Trinidad and Tobago, and Jamaica. And these countries are at different stages in the process of implementing the ESP or establishing the institutional basis for its implementation. Those countries implementing the ESP are financially supported in the framework of the Spotlight Initiative program. But as Mariana mentioned previously, St. Lucia and Suriname are considered to be self-starter countries, as they're the only countries in the region that do not receive funding from the Spotlight Initiative, but are planning to implement the ESP using their own funding and resources of technical support and guidance from UNFPA. Other countries that are in the baseline or inception phase of implementing the ESP include Anguilla, Antigua and Barbuda, Aruba, Bahamas, Barbados, Bermuda, British Virgin Islands, Cayman Islands, Curacao, Dominica, Grenada, Montserrat, St. Kitts and Nevis, St. Martin, St. Vincent and the Grenadines, and the Turks and Caicos Islands. Now, it's key to note that the fact that most countries are in the early stages or maybe are not implementing the ESP in the region does not mean that they do not have policies or response services for GBV, or that these are inadequate, or there's a lack of political will to address GBV. This is precisely why we've developed the resource package to really support countries going forward to take the ESP, what is this very global toolkit, and make it as operational as possible to ensure a harmonized and standardized approach to ESP implementation, building from learning and best practice across the other countries in the Caribbean region. Next slide, please. So this just gives you a broad overview of the overall process to implementing the ESP. So it outlines 10 key steps. And note, this is not always a linear process to follow, and several steps may need to be revisited throughout the project inception and implementation phases. But as you can see, what this promotes is an evidence-based and contextually specific approach to programming. And the resource package that we have developed out of this lessons learned study supports service providers in each step of the implementation process. Next slide, please. So that said, though we have these tools broadly contextualized for the English and Dutch-speaking Caribbean, it's key to emphasize that it's not a one-size-fits-all approach, and these tools should always be further adapted and refined to that specific country context. And implementation may look slightly different across different operational settings, which may have varying degrees of services or sectors already established. So with that, let's dive into some of the key findings. Next slide, please. Actually, I think maybe one more. Yeah, perfect. So here you can see we start with multi-sectoral coordination, and this is arguably the essence really of the ESP and one of the most key areas to highlight. So one of the key challenges identified by many national stakeholders was ensuring a coordinated response among the different service providers. There are limited coordination platforms or mechanisms for multi-sectoral engagement. So service providers often cited working in silos, and there would also be limited engagement with non-governmental organizations or civil society organizations in particular. There's also this absence of standardized templates and common contextualized tools for assessments, monitoring, and evaluation, and service provision more broadly, whether we're talking about intake and referral forms or referral pathways or information sharing protocols, which is really crucial to actually catalyze multi-sectoral coordination between and within the different service providers. Key respondents also identified gaps in technical expertise and training and capacity building across health, social services, justice, and policing sectors. Again, really key for ESP implementation and ensuring that effective multi-sectoral coordination and cooperation. Lastly, key informants cited fragmented legal and policy frameworks, including gaps in national level SOPs and guidelines, which also impact on coordination across many countries. Some of the best practices identified were the development of regional contextualized national GBV standard operating procedures and referral pathways that are up to date. This is across, I think, 16 countries since 2020. Strong assessments as well were identified as best practices. So the case of Trinidad and Tobago can provide a catalyst for strategic engagement with government stakeholders. Now, another key barrier relates to structural resource limitations, and this is kind of an intersecting area. because ESP implementation is such a multi-layered process with human resource intensive activities, which is quite challenging alongside other roles and responsibilities. So given the insufficient financial or human resources, national gender machineries or gender focal points are often double hatting or triple hatting, and there's also quite a high staff or focal point turnover in some cases. So again, training and capacity building was cited as a key barrier to ESP implementation, and this could range from attitudes or lack of gender awareness or socio-cultural barriers in a given country, particularly when you don't have buy-in maybe from more senior level stakeholders or accountability or ownership at a more senior level, which is really crucial for advocacy and resource mobilization generally. So there is a need for greater budget allocation to GBV response by working with government ministries, different departments and agencies, and building their capacities to mobilize resources and develop costed national action plans. Some of the best practices identified here were also the proactive resource mobilization outside of the Spotlight Initiative. So the cases of St. Lucia and Suriname, who identified gaps in multi-sectoral GBV response services and reached out to UNFPA to mobilize resources for action. Next slide, please. So we also identified challenges in ensuring a harmonized approach to ESP implementation to ensure technical coherence and quality service provision. So a need for standardized templates and guidance that are both sector specific and multi-sectoral. There was a lack of either technical expertise or confidence in ESP implementation and coordination among gender focal points. At the same time, it was highlighted that capacity building should not only be for gender focal points, but more diversified for other ministries or government agencies. So sensitization and buy-in is key for this. Most respondents highlighted that capacity building initiatives and skills development should be more integrated institutionally, so formalized whether into performance reviews or on-the-job training to ensure sustainability. Though we did see some best practices, namely national level strategies established to build the capacity of service providers in Suriname, Belize, Jamaica, and the British Virgin Islands. Regarding assessments and monitoring and evaluation more broadly, so there's varied approaches in conducting assessments in M&E generally, a need for more standardized and harmonized approaches, including the dissemination of findings. We identified gaps in ensuring meaningful participatory approaches, particularly with regards to the inclusion of other individuals and groups at heightened risk, such as persons of disabilities, LGBTIQ+ identifying individuals, migrants, ethnic minorities, among others. Absence of national GBV data collection systems and databases in line with minimum standards for data collection, analysis, reporting, as well as dissemination and information sharing. So we did identify generally across the region a lack of standardized M&E tools and gaps in information sharing protocols or systems between the different service providers at the national and subnational level. And some of the best practices identified were conducting readiness assessments that are very operational. So for example, in Jamaica, their assessment has informed the review of the national strategy on GBV. Next slide, please. The other big thematic area, which Mariana previously touched on, that we can say is related to emergency preparedness and response. So we identified gaps in relevant protocols, tools, and guidelines for ensuring the continuity of GBV services in emergencies or crises. So this gap in awareness or complementarity in practice we see between the essential service package and the GBV and emergencies minimum standards. So we have a lack of alignment or linkages and coordination between humanitarian and development funding, policy, and delivery mechanisms in GBV response. Now, the ESP is largely used in development and stable settings where GBV programs, including for law and policy development implementation, aim to build systems linking different response sectors. So systems must be sufficiently resilient to exogenous shocks. However, these are increasing due to climate change, as we know. So as such, even systems in stable settings must be prepared for humanitarian crises, whether they come from conflict or disasters or public health crises like COVID-19. So this requires a greater understanding of the intersection between the essential service package and the GBV in emergencies minimum standards, which can ensure a high level of preparedness through supporting partnerships, coordination, and planning of GBV multi-sectoral services. Next slide, please. One more. Thank you. So Mariana touched a little bit on what's inside the resource package. So based on these identified common challenges and bottlenecks, we can say across the region, we wanted to develop a resource package that would really support countries throughout the process of implementation and be extremely operational. So I will just provide you a snapshot of the current iteration of this package, which is comprised broadly of an ESP implementation guidance note, which provides a roadmap to using the different tools in the package, how to use the tools at different stages, and when and at what stage of the process. So it's the most important document, I would say, to guide you through using the resource package. And then there's, of course, some practical tools I'll show you in a moment for the different stages of implementation, and then training materials, which are a key component of the resource package. And lastly, additional support material, which provides a wealth of technical resources, guidance, and additional training capacity tools for GBV service providers. Next slide, please. So this is just to give you a better idea of the guidance note. This is the table of contents page, which provides you a bit of an outline of the different steps and an overview of all the different tools and training materials. Next slide, please. So moving to the specific tools themselves, which are designed to address the gaps identified from the lessons learned study, we have assessment tools, rapid and comprehensive. So again, considering stable settings and rapid onset emergencies, service mapping tools, other tools supporting assessment processes to ensure an evidence-based approach to our intervention. Generally, we have focus group discussion tools, FGD tool, key informant interview tool, support for data collection, forms, training, supplementary materials, the list goes on. We also have sector-specific implementation checklists to guide implementation at every stage, which forms the basis of the development of a GBV action plan to ensure quality service provision. So sector-specific service guidelines, again, ensuring quality service provision in line with interagency and global guidelines, which inform the design of our intervention. Quality assessment tools for services established, so case management services, health, safe houses for survivors, women and girls safe spaces or one-stop centers, and non-medical entry points for GBV response services. And we have a stakeholder presentation summary PowerPoint for partners to then present and disseminate their findings, and which inform the basis of a national action plan. We also have costing tools to support the development of national costed action plans based on the assessments. A joint action plan tool to guide priority actions for implementation, including different roles and responsibilities among the different service providers and coordination bodies in a given context, which also ensures greater accountability and monitoring overall. We also have proposal templates, including a concept note template, full proposal template, which includes a log frame and a budget. A standardized terms of reference for GBV focal points that can be adapted to a specific ministry or organization. And lastly, an M&E tool that can be used to capture progress against implementation and capture key challenges and bottlenecks and best practices in real time. Next slide, please. So the training tools and handouts, we can provide the details here, but I do strongly encourage you to take a deep dive into this folder specifically. But the content you can see broadly includes a GBV core concepts module, an introduction to the ESP and each sector, their different roles and responsibilities, how to do safe and ethical data collection in practice, GBV and emergencies minimum standards, and again, going back to that complementarity with the ESP. And then more thematic guidance on GBV and sexual and reproductive health mainstreaming, as well as more specific issue areas like dignity kit distributions and so on. So the training modules are essentially here to guide you in the application of the tools, and they include handouts as well as a post-test, proposed agenda that can be adapted, and training certificate even. So it's quite comprehensive and very operational. And all of these tools and training materials are available in both English and Dutch. And lastly, and before I would hand over to Mariana, there's also a folder of support material I mentioned in both packages. And these are technical guidelines and resources that are specific to the Caribbean region or global or regional resources. And these are not all translated into Dutch, but only available in English because they are supplementary resources outside of the core content or essential content of the resource package, we can say. And with that, I will hand over to Mariana, who can elaborate a bit more on these supplementary resources.
Thank you so much, Megan, for this very comprehensive and clear overview. Tommy, let's go to the next slide, please. We're almost done with the launch. Just to take over from what Megan was mentioning, I just wanted to give you a brief overview of what you can find, the resources that you can find in addition to the ESP resource package, which is going to help you as a supplement. We have compiled a folder with key, essential, and global documents and guidances and standards that you can use, right? And that you can have in your computers, right? If you are a specialist working in this area of work, if you need any references or any guidance as to how to set up something or how to improve the services or something like this, you can always find so much guidance globally, you know, like we're constantly releasing new documents and new guidance notes that you can use. So we wanted to make sure that you have access to everything, or mostly everything that has been launched. I wanted to particularly draw attention to 3 specific guidances that we have launched in the past years, tailored to the Caribbean, right? And we have launched this in the past, but just as a reminder, you can also find those in this folder. The guidance for the establishment and the management of safe houses, safe shelters for survivors of GBV in the Caribbean region. We have the Dignity Kids guidance note as well. This is mainly used by UNFPA and UNFPA partners, but it is useful for any organization who is distributing Dignity Kits, because it's not just, you know, about distributing hygiene items to women and girls in need, but it's an intervention that has to be linked to GBV programming. So through this guidance note, you can see how you can actually complement your programming for Dignity Kids. You also have the guidance note that we developed as well through extensive consultations, all of this, but a guidance to mainstream GBV and SRH into emergency shelters, specifically used to respond to emergencies in the region, and how emergency shelter managers and authorities can mitigate risks of GBV inside these shelters, and how you can make sure that you provide the minimum services in these shelters, right? So this goes hand in hand with the ESP, and ensuring that all the services that you set up in a let's say stable context can continue during emergencies, right? And all of this essentially it's a priority during the preparedness phase, right? Preparedness is the most important thing in order to actually respond to emergencies, knowing what it is that you need to do and be ready for emergencies. Even if you have to adapt, at least you have some minimum preparedness actions in place. We also include global essential guidances and standards, like the minimum standards for GBV in emergencies programs. These are interagency standards. You can find a lot of information here and additional resources that you can use. We also include the latest documents and technical guidance that UNFPA has developed at the global level to face the new threat that we have in terms of technology-facilitated gender-based violence. We have launched a guide to make sure that we make all spaces safe, including online spaces. And we know that this is a conversation we've had in the Caribbean. So this is also included there. We also include additional guidance if you are engaging in GBV prevention work, which is the Respect Women framework. We include guidances by area of work, such as the clinical management of rape and intimate partner violence guidelines, the interagency case management guidelines as well that you can use to adapt to your service provision. And this is just a summary of all the different resources that we have put together for you. You can find all of this in the website that we're going to share with you just now, and you can download it and use it as you see fit. Tommy, let's go to the next and final slide, please. Thank you. So here we are. We are now at the end of the launch. By scanning this QR code, you can download. It will redirect you to the website at UNFPA Caribbean. You can download the lessons learned study, both in English and in Dutch, and you can also download the resource package, including the guidance notes. So Megan and Tommy have been sharing the links to the websites. So you can either scan the code or you can follow these links. You can also navigate a little bit on the additional resources that we have launched at UNFPA Caribbean. We will be sharing the recording of this webinar as well with you and everybody who was not able to join today. We know that it's a very busy period for everybody. So we thank you so much for making the time today to be with us today. All of these resources, as Megan said, have been developed in English, but also in Dutch, just to make sure that the Dutch-speaking countries are also able to use them. And this was also a request by standing members of the community of practice. So again, we deliver on our commitments to you. We really hope that this is going to be useful for you and that it's going to contribute to making sure that we strengthen the response and how we show up to survivors in the region. Yeah, let's go to the next slide. And I don't know if there's any questions that anybody wanted to ask, any comments, or we know it's a lot of information, and perhaps you just need a little bit of time to go through the resources, to read through the report and understand a little bit the package when you download it. We're always available. If you have additional questions, you can always reach out to us bilaterally as well. You can reach out to your UNFPA representative in your country. You can reach out to me as well through the community of practice. You have my email as well. And yeah, I think, let me see if we have any questions, but I don't think so. There was a question on education. Yeah, somebody who's very excited about the education sector standards. And yes, definitely, this is going to be available soon. I'm not going to go a lot into detail, but essentially the guidance is going to be in line with what we have presented to you today, because it was a new creation, let's say. UNICEF is taking the lead, and it's taking a little bit longer because we have to basically invent it from scratch, but it's almost done, and we're going to be launching this quite soon, I think early next year or something like this, but it's going to be shared with everybody so you can actually see what the standards are and how we can prevent and respond to GBV in schools and in the education sector. So this is going to be available very soon. I think we have a hand raised. Sherwin, yes, go ahead. The floor is yours. I think you can unmute, right? You needed to be a co-host.
Yes, thank you very much, Mariana. Good morning to everyone. So in addition to what Mariana just said, the Secretary just wanted to advise member states that this project, even though it was started before, it is now a very important component in the violence reduction strategies that the heads having us develop following their April symposium that was held in Port-au-Prince, and that the Secretariat will be following up with member states to ensure that, you know, they're going up, checking up on them from time to time. It forms part of the programming, some of the work programming for some of the program managers at the Secretariat at this point in time, and we will be in touch with member states, both informally and formally, to ensure that they who have everything that they need basically moving forward technically to be able to incorporate this into their national plans. And just to, you know, re-emphasize that this is really a very critical component in the declarations that the heads meet as one of the contributions to reducing violence within our region. So I just wanted to advise them on that. Thanks.
Thank you so much for this contribution, Sherwin. I really appreciate this commitment and this follow-up. So thank you. Thank you very much. I don't think that we have any further questions. I do believe that it is quite a big package to go through. So please go ahead and download the package, the study, read through it, use it. We really hope that this is going to be useful for all of you and that you enjoy it and that it essentially makes your job easier. So I think we're 5 minutes over time, so perfect timing. And thank you so much, everybody, for being here. We hope to be in touch soon, and don't hesitate to reach out if you have any questions or comments you wanted to share more bilaterally. Thank you, everyone. Have a good day, Christmas, New Year's, end of year, and we'll be in touch soon.
Thank you all. Thank you, everyone. Happy holidays.
Happy holidays.
Thank you. Bye.